Good morning, everyone, and thank you for joining. We're very lucky today to have Dr. Menon with us.
Okay, great. Thank you, Ayman, for this opportunity. I was asked to speak about our work on the LIMS1 GCC2 region as a non-HLA mismatch in kidney transplantation. And I'll call this talk Genetic Architecture of the LIMS1 GCC2 region and a template to unravel mechanisms of non-HLA mismatches. So those are my disclosures. They are not relevant to this, nothing related to this being mentioned in the presentation. So I'll just give you a quick overview of HLA and non-HLA mismatches. Talk a little bit about the scales of genome-wide non-HLA mismatches between the donor and the recipient, and what recent data has suggested as associations with graft outcomes, and focus on the bulk of the talk on discovering mismatches of disproportionate significance to kidney transplantation, and focus on the LIMS1 GCC2 locus on chromosome 2, and how we've had some success in trying to unravel the mechanism behind this intronic non-HLA mismatch. So, I just finished fellowship, and Rabi, who was a junior fellow, said, what is, we keep saying HLA matching and mismatching kind of separately. What does this exactly mean? And we really didn't have a good answer that was convincing to him. So we said, why don't we look at the UNOS data and focus really on deceased donor transplants and try to look at these two variables as reported in UNOS, HLA mismatch versus HLA match. And you can see that when you look at these variables individually, and this is data that we published in 2017, you can see that every level of HLA mismatch associates with a worse outcome for graft survival, death cell graft survival. And similarly, every level of HLA match associates with a better outcome, as one would expect. But HLA mismatching is not simply 6 minus HLA matching. And when you put the two of them together in the same model, you see that it's really HLA matching that carries the significance, and HLA mismatch significance gets washed out. And this is especially true when you look at when genotyping was introduced for measuring mismatches and matches in UNOS. So that's after 2003. And so we asked, why is this? What are the problems? So there are several issues, I think, which could explain the difference or this observation. But one of them we thought is maybe HLA matching was showing to us co-inheritance of non-HLA genes and variants at higher levels, especially at higher levels of matching. For instance, ancestral matching, certain HLAs go together with Caucasian ancestry, and what we may be picking up is really linkage to other areas or certain haplotypes. And the fact that non-HLA mismatches are important in allotransplantation has been shown by really nice experiments which hold true to this day. For instance, if you take a syngenic mouse, but you transplant a male skin into a female mouse, that because of the Y chromosome antigens, the male skin will reject, whereas a female skin into female mouse will not reject. And so this is clearly a rejection phenomenon that's mediated by antigens outside the HLA region. And this is a paper, this is a literally old paper, but it makes the case. This is from Dr. Colvin's group from Harvard. And what they showed is that when you look at people who are HLA identical, and they had a few cases of HLA identical transplants, they also developed what looked like histological ABMR, but they did not have any HLA antibodies because they were HLA identical. And so this is presumed that these were related to non-HLA antibodies. So a pristine way of showing this phenomenon. Of course, we know there's more than this. And it's important to remember that the HLA region is a really small region on chromosome 6, and we inherit variably genetic loci in all other chromosomal regions. And just to give a quick overview of some of the terms I will be using, first to remember that most of our genetic code is made up of non-coding regions, introns, intergenic regions, and protein coding regions are very small, about 1.5% of the total genome. And when you have variations in the protein coding regions, they can either alter the amino acid when they are called non-synonymous variation or mutation, or they cannot alter because there's some degeneracy of the genetic code, which when you call them synonymous mutations. And so majority just from one person to another, just because 80, 90, 98.5% of the variants are intronic, we are more likely to be variable in our intronic regions. So now coming to some data that have specifically probed genome-wide mismatch signals from non-HLA and tried to associate them with outcomes. And there's a bunch of data to this effect, but I think this paper in the Lancet from Dr. Oberbauer's group in 2019 is really a very nicely done paper. They're a predominantly Caucasian to Caucasian Austrian cohort. There are about 480 patients. They genotyped the donors and the recipients in a genome-wide manner. They adjusted for HLA matching by using eplet matching, so not just two-digit HLA. They used high-resolution genotyping and eplet matching. And in an adjusted model, they were able to see that when there were mismatches in non-synonymous SNP mismatches, that means where a new peptide was potentially introduced by the donor to the recipient, only if you just tally those kinds of mismatches across the genome, they had a kind of ordinal association with death sensor graft loss, as you can see here. And they went on to show that this was restricted really to proteins that were predicted to be the transmembrane or secreted, parts of the cellular compartment. And when they did a peptide array for some of these patients, they were able to see that these patients were the patients who were in the high, non-synonymous SNP mismatch group tended to have a diverse array of non-HLA antibodies promoting ABMR. So they were concluding that